What's going on, guys? Welcome to another episode of Healthspan Academy. I'm your host, Craig Shearhart, here with my co-host, Kyle Freiberger. And our special guest today is Dr. Laura Brown, who is a naturopathic doctor here in Guelph and a functional medicine practitioner. And she focuses a lot on gut health. She's also certified with the Heart Math Institute. She's done a Chris Kresser certification, the Adapt Trainer practitioner. So we're going to talk a little bit about that and some of her practice. So, well, first off, Laura, thanks for being here today.
Oh, thanks so much for the invitation. I really appreciate a chance to chat with you both.
Yeah, awesome. Been looking forward to this. So I want to start with just a general question with your practice and your discipline, because I think there's a bit of a misconception from some people around what a naturopath does versus what they can expect from an ND and that difference. And how does your practice specifically vary from what people can expect from a trip to a doctor?
Right. So, I mean, it comes first and foremost, I believe, from our training. I mean, we have undergrad and then we go on to Naturopathic Medical College, which is a 4-year program. And then typically we spend another year training in pharmaceuticals and writing the certs for that. Some people go on to write an IV license where they can give IV vitamins, so intravenous injection of vitamins. I didn't do that. I didn't feel it was necessary for my practice, although there are some people around that do, and they have a very successful practice doing that. When it comes to meeting with a naturopathic doctor versus a conventional medical doctor, like your family physician, they're basically coming in. You're doing one concern at a time, and they're essentially looking at, do you need lab? Do you need a referral to a specialist, or do you need a drug, or like an imaging or something like that? So that's kind of their toolbox of what they're going into to deliver for you. With a naturopathic doctor, it's more of a holistic approach. So we're looking at the essentially the mind, the body, the spirit, and how things are all interconnected. And I really love that. And I love looking at, what are the obstacles in the way of health, and what do we need to do to remove them? And then are there, deficiencies going on that we need to support?
Right.
And we can do lifestyle and diet recommendations, and then we go on into our modalities, which can include, nutritional stuff, nutrigenomics, which I think we're going to talk about in a little bit. But your vitamins, your minerals, your supplements, your plant-based medicines, and then like tinctures, botanical medicines, mixing, blending, like basically herbs that are in a liquid format, acupuncture, Chinese medicine, homeopathy. And then, we kind of go off into our different areas as we're continuing our education, like I did with the Heart Math certification for helping people with stress management, using the science of the heart. And then the Chris Kresser Adapt Train program is a 1-year long, pretty intense program. You're going through spending 8 to 10 hours a week all year long, and then writing tests all the time throughout it. And it's I took it because I wanted more in-depth case study, like complex cases with lab component. I wanted to hone in on more of the preventative type of stuff, not just wait like the conventional medicine waits for the markers to say you have a disease. I want to look at the markers and say, oh, here's the picture and the trends of what's going on. Let's not let it go any further.
Right.
So looking for those early markers in preventative medicine. And naturopathic doctors can often do like those nutrigenomics, like looking at the genetic reports and seeing what, how we can best tune in and keep your genes working for you rather than against you. We do a lot of stuff with food sensitivities, and for me, a lot with gut health and the specific labs that we might run for that your family medical doctor has access to, but not training. So they often disregard them as something that's optional.
Right. Yeah, I love that. And just from my own, I got the pleasure of coming in to see you, and that definitely lines up with my experience. And I think what struck me the most was you feel like you're being coached in that setting. Whereas in a doctor, it's just like, there's a quick conversation. It's maybe like 10 minutes total. You see the doctor and it's like, oh, this hurts. Okay. Try this medicine or drug. And I mean, there are doctors that care, and it's part of the nature of this, I guess, the shortage of medicine. They just only have so much time to deal with you. But I felt like there was a lot more attention to detail when I came in to see you. And I like the fact that you do work to get to the root cause instead of just getting rid of the symptom, which I found awesome. Um, and I actually want to ask about some of the. So you worked with me a little bit on the dietary impedance analysis, and also did analysis for my 23andMe profile, which was like a genetic analysis, and both tests actually lined up with what I was kind of seeing in my own experience, and they both lined up together. So talk about those two tests and what people can expect from those type of tests, and how you help them and walk them through that.
For sure, yes. The bioimpedance test for the food sensitivities and just looking at the organs is basically, I mean, everything in the universe is energy and waves. And so we've got the waves of the food put into the computer. And I always say, like an apple is an apple, but there's over 20,000 different varieties of apples grown all over the world in different soils and different climates and things like
Mm-hmm.
that. So there are some variances. So, in that there is some imperfection to what's going on, but still an apple is an apple. The idea of the test is to run that wave through your body so that you can see and measure the nervous system's reaction to it.
Mm-hmm.
So it's quite helpful in that regard. And as you go through, you can see over 250 foods. And I'm looking for trends too. Like sometimes you see, things come up and going, oh, if lots of things come up, that the body is sensitive to at the moment, then it's often leaky gut or,
Mm-hmm.
compromised gastrointestinal barrier. If it, sometimes you look and it's like, oh, yeah, maybe it is those lectins, like you always hear everybody asking about because they
Right.
see, all the plant paradox commercials on YouTube pop up. Um, or sometimes it's, more FODMAP, or maybe it's more citrus, or, so I'm looking and seeing, or maybe it's like all the grains, or like it's lighting up and it's like, okay, maybe we're dealing with something a little bit more than a slight, gluten intolerance. Maybe we're dealing more with either a non-celiac wheat sensitivity or based on the patient's symptoms. And always you're involving the patient's symptoms. You're not just looking at the test.
Right.
You might, say, let's do a blood test and just really know uh, where we're at with that so we can see more in depth detail on some things. And there's some tests you can run for that.
It's very
And
cool.
then does that help with the bioimpedance test for the foods?
Yeah, yeah,
Yeah.
absolutely. And I think it gives you a bit of peace of mind getting it tested a few different ways, and it came up with really similar results. And like I think what blew my mind was like, what's going on with your skin? I was like, my skin, I don't know. And then it took me a minute to realize, and I like was out in the sun all weekend, so it's probably just a little sunburn.
Yeah. Yeah.
But
Sometimes
that
it's just
those are,
something simple.
yeah, it's like more aware than you are. It's kind of spooky. It's pretty cool.
Yeah, it knows.
Yeah.
And then you can also do like environmental stuff with it. With in the computer we have like all the horse hairs and dog hairs and
Hmm.
pollens and some things like that, some medications and stuff like that. And I can also plate on the equipment itself substances and just see how that balances or how the body responds to that. So it's quite interesting, and it's really nice when you see that correspond and confirmatory for the individual with other tests and their own like living experience. So kind of
Yeah.
confirmatory.
It's a good way to I somewhat simplify something that's super complex is just by just turning it into a voltage, I guess, somehow. It's crazy how that works. Very
It's a
cool.
great place to start. Yeah.
Yeah.
I was going to jump in here. We're talking about diagnosing all these different ways, trying to help a client or a patient. Blood testing was one that really opened up my eyes. Like I had been blood testing through a medical every year for my pilot's license.
Hmm.
And, in that blood work, it was always, okay, you've got this variance, kind of these limitations, whoever made those up. Hopefully it's in between there. Otherwise, you get a talk from your doctor to change your lifestyle or change what you eat. But working with you, because I've worked with you as well, why, tell us why blood work is so important, and then exactly like those trends, kind of what you look for, and then how you work with your patients through those trends, and just to like, you know, for me personally, again, to kind of relate this, and what I'm trying to get at is, I was supplementing, thinking, okay, well, normally, like everything I've read, normally everybody's deficient in vitamin D and deficient in magnesium and deficient in all these different things. So I was trying to like supplement, and then I was like, okay, then I'll go for the test, and then I'll see where I'm at, and then I'll just kind of fix it from there. But is that correct? Or I'm realizing now maybe it was more you should test first, because I feel like it would have probably helped me eliminate a lot of problems. What can you tell us about that?
Absolutely. Yeah. Like the bioimpedance test that I mentioned before is It's not clinically diagnostic as far as Health Canada is approved. So they haven't approved that for that thing. So that's where the blood tests are important. And yes, to look at magnesium and look at vitamin D. Now, magnesium is kind of a tough one because it's in so many tissues, right? So it's in your bones, it's in your blood cells, it's in your serum. If you're just measuring the serum, you're not getting the whole picture. Okay, so that can be kind of challenging. You got to keep that in mind for a few other different things. And like B12 is a really good example to measure. If somebody's supplementing often, it shows high, and that's okay. It's not the end of the world. It's a water-soluble vitamin, so you're going to excrete what you don't need. However, sometimes people can falsely measure high because the test isn't perfect, which is interesting. But for all intents and purposes, given you don't have any clinical symptoms that would indicate otherwise, you assume the test is fine. The blood test can be diagnostic, meaning that you can, and as a naturopathic doctor, we can diagnose diseases, which is key and critical because now we can say, this and this. When you look at, say, something like vitamin D, you can have too much or you can have too little. So as you're saying, Kyle, like I think everybody's deficient, so let me just pop 6,000 IU a day for a year and see where I'm at. Well, that may not be beneficial for you. If you already had good levels, you might end up in an overage, and you could start feeling fatigued and just feeling kind of run down for no reason, and it could be a high vitamin D level. And it's a fat-soluble vitamin, so it takes a little time to come out of the system, and then so you can kind of watch it for 6 months, and then you retest again. So it is good to kind of monitor things like that, especially critical things like B12 and vitamin D.
Yeah, I feel like that was another thing that having those voids in those supplements or those vitamins or those minerals, we kind of go through life thinking, like I'm at a good spot, I feel energetic, but then once you top up those deficiencies through working with a naturopath and actually, making sure you have all of these deficiencies topped up, like the energy levels, all of these differences that, I personally have noticed. Now this is like my new norm. And so like now I'm much more aware, and this kind of leads me into another question I had for you was, being in tune with your body and actually listening to your body. I think many people kind of either don't know what to listen to, or don't have any clarity as to what to listen to as far as their body goes, or they just they don't know who to even talk to about asking the right questions, right? So walk us through that, if you don't mind. Like, how would somebody listen to their body as far as trying to fatigue, stress, how that shows up in your body, stuff like that.
Yeah, I love that question because there's so many tools and trinkets out now to measure, right? Like even your Oura ring, blood glucose monitors, and there's lots of different tools and trinkets out there to measure. And the biofeedback is good, but sometimes I question, is it absolutely necessary? It's interesting. It can be good and helpful and fruitful, yes. But at the end of the day, you likely can tune into your body and understand that. And I always say, if you're quiet enough in your own body, you already know what's going on. And it is a skill, right? Like we're not really taught. Our body sends us messages all the time. Like I'm looking at it as a trained practitioner. I'm looking at the skin, the hair, the nails, because they tell us a story, right? I'm looking at the eyes, I'm looking at the stature, right? This all tells a story. So I try to teach my patients to learn those cues as well. A really interesting one is hunger and anxiety. These they both produce similar physiological cues in the body, and then the brain has to decide: am I hungry or am I anxious? And for some people, I mean, I had this, and it was like, oh, hey, I like to eat, I'm hungry, right? So then you eat, and then you get to a point where you're like, you know what? I really don't like how I feel in my body. I'm eating way too much, and I'm eating when I'm not really hungry, but I feel like I'm hungry. What gives? So then I, used to say to myself, okay, Laura, what ran through your mind, just before you thought I'm hungry? And it'd be like, oh, yeah, I'd done something that I felt bad about, said something silly that, maybe I could have said more eloquently, and, that type of thing where you're just, feeling a little bit anxious, and you kind of, roll back the reel and you're like, okay, I'm anxious. So then it's like, okay, food isn't going to fix this problem. I need to go and correct the issue, go and talk to that person, or, go and make amends. So
Hmm.
that's just one example, but I love to teach people how to tune into their body's wisdom and listen. And the body makes, will give us language that doesn't often make sense. And we learn this through like the homeopathic intake, because the body has language, and it comes up to the right brain and then has to go over to the left brain to give it a label and logic and some language.
Mm-hmm.
But often what the body is bringing up is garbly-goop. It feels smushy mushy, like whatever. But I love that stuff because that's the raw language of the body.
Yeah. The when you commented about like an Aura Ring or a Whoop or we've glucose monitor, I've worn all the above. But the noticeable thing that I found out of wearing those is that it just kind of helped. I was listening to my body, and it just kind of helped, and reassure me that what I was listening to was correct. And it's funny because before I even look at my Aura Ring in the morning, I can basically tell you what my HRV is, or where my resting heart rate was last night based upon how well I slept. Like, did I get my lowest resting heart rate like at 2 a.m. where I kind of wanted it, or was it later in the night, which for me is, it's a poorer sleep typically because I ate something late at night and then I wake up and then my HRV is tanked because my body hasn't recovered properly. But I found that once I started really listening to that, and working with you, I came into your office one day. I'm like, or I emailed you one day. I was just like, you know what? Like, ever since, because you asked me once, do you ever feel hot? Or I said, I told you that I felt hot. And you're like, where? I'm like, well, I guess I never really asked that question. Like, I never really paid attention as to where am I hot. I thought just heat radiated everywhere, right? So then I think I emailed you one time. I was like, bottom right abdomen, and you're like, come in, and you did a maneuver and talked me through it, talked me exactly what was going on, and ever since then, it doesn't happen anymore. And there's just like a method to it. So I can definitely really resonate and appreciate listening to your own body. And then it's like you said, like you go into gut health and stress, and everything's intertwined. And typically, if you listen to your gut or you listen to your brain, you know the answer. Maybe sometimes people just don't want to admit it, but yeah, then just like talk us through kind of how would you work with a patient once you've done all this testing? What are the next steps? Like clarifying, you know, you can't see a target that you can't, or you can't hit a target that you can't see, is the saying, right? So how do you identify the target, and how do you get your patients to that target?
Yeah, so that kind of comes into a bit of the coaching part, right? When you're working through, and I'll kind of answer two questions in one here, because um, I'll start with your question. So it's really finding out, but you have to have conviction, right? If somebody wants to make a change, they have to have conviction. Even with conviction, sometimes I find people are challenged because changing habits isn't easy. And you have to do something over and over again before it becomes a habit.
Mm-hmm.
And often the positive reinforcement is helpful. But sometimes it takes some time before you see that positive reinforcement, or you have other outliers that are, complicating the picture, that, you may not be getting a clear result. So it's helping, I think sometimes that seeing the labs in full color are helpful for some people. Seeing the biofeedback, like you talk about with the O-ring, or I use it initially with the heart math program, with the HRV, and helping people actually see the rhythms, in chart-based format, and they can actually see things happening, and then it becomes very confirmatory. So that can be encouraging. Um, but I find it's individual. Sometimes I'm drawing pictures and we're like charting it out. We're making a game plan.
Mhm.
Um, when I'm doing a script for supplements, it's like, okay, this is the dose, this is the timing, this is the duration, this is why we're doing it. And I think that's really important, because you're not going to do these things necessarily for forever, right?
Mm-hmm.
Things serve a purpose and then you're done with them.
Mhm.
Sometimes people think, oh, I need to be on this because, she said I needed to be on. Well, how long have you been on it? Well, I've been on that milk thistle for, I don't know, 3 years, right? Somebody coming in, it's like, okay, well, your liver probably loved that for the first little while, but maybe it doesn't really want it anymore. So
Yeah.
it's understanding that. Something like magnesium, maybe initially you're taking a higher dose to kind of top up the kitty, and then or the stores, and then and then maybe you're just taking a lower dose for maintenance because you are burning through it. It's used in like 300 transactions in the body.
Hmm.
Hmm.
And
So yeah.
sorry, just to so to close the loop on what you're kind of alluding to is you work with people in a coaching mentality where people want to change, but they once they get clarity, it's up to them to kind of figure out why they want to change, and then they'll work with you, but you're not typically telling them exactly what to do. It's maybe just like here are the tools, and then it's up to you to kind of like implement them. Does that make sense? Like you're
Well,
not
I mean, I lay it out for them pretty clearly if they have supplement plans. So that's laid out pretty clear. So I'm
right.
telling them what, where, when, and how. And then I help them with their day, like, oh, I always forget to take that. Well, put it beside your toothbrush before you go to bed, and then you'll remember. So sometimes simple little
Right.
things like that.
Hmm.
Like, why are they forgetting to take it? Or why aren't we succeeding? I had a patient in a while ago, and she couldn't stop eating the cookies, right? She wanted to lose weight. She wanted her blood glucose to be better, but, she'd sit down and eat the whole roll of cookies.
Hmm.
And then we dug into a little bit deeper, and it wasn't her, her hunger for food she was trying to serve. Her soul was actually hungry,
Hmm.
Hmm.
right? And so she needed to feed her body something other than food. She needed to feed it, time with friends,
Hmm.
time doing something creative,
Yeah.
communicating, like reaching out in community. And that was the nurturing that she needed. And so it comes, food isn't always a treat. Food isn't all that we need to nourish. We need other things to nourish us. So sometimes it's finding out why aren't we succeeding, and kind of looking at that whole picture again to figure things out. And I always say to people, like, just, I can't give new advice over email, but if you're stuck on something or have, a quick question on something, just send me a quick note. If
Hmm.
it's going to take me 2 minutes to respond and I'm just clarifying something, I mean, that's great. I want you to succeed. If it's something a little more involved, I say, hey, you know what? Let's do an appointment, whether it's like a 15-minute or a 30-minute.
Hmm.
Um, let's get that addressed, and that's going to take a little more time, and it's new advice, so we need to go through it. But often, if somebody's just, I'm stuck on this, I don't know, or I went to buy this and I can't find it. Is there something else?
Right.
It's things like that's helping. It's just like, hey, and here is your resource. If it's just something quick, yeah, that's not an appointment fee. But if it's a little bigger, then yeah, it is.
Awesome.
It's great. I I like that explanation. It kind of segues into where I wanted to go next. Because one of the things I noticed in your book, and just even in seeing you, is that it's not cookie cutter. It's not like this is the way you must eat. These are supplements. It is so individualized. And I even just talking about the different dietary methodologies, paleo and keto and plant based, and all. You kind of touch on all of those in the book. And along those lines, there's different directions we can take. When we decide we want to do an elimination diet, there's different tiers, and they're all like slightly more involved or less involved than others. How do you advise someone on which course to take with an elimination diet based on where they're at? Like, how do you start that conversation? Because I'm sure that like the platinum, where it's like a 6 month process, is probably not going to apply to most people. How do you tackle people with that?
Depends on how far advanced they are in their self-care and the health regimen.
Hmm.
If somebody is used to eating out all the time, they don't cook at home and they buy all their meals. It's starting in small steps, and starting
Hmm.
one bite at a time. I always say it's evolution, not revolution.
Hmm.
So it's starting in small steps, and that small step might be, let's try to get some more vegetables. Let's just focus on more vegetables.
Right.
And when you're out, let's order a salad with just some oil and vinegar. Or if you're picking up, let's go to, like Freshie and get a salad instead of going to, Subway and buying a sub, something. And then just recognizing the food qualities and what you're adding in and how that's working for them, and what might be in some of that stuff. So it's sometimes working there. If you have somebody that's cooking, then it's more, here's how to stock your fridge.
Hmm.
Uh, Here's how you would go about it. Um, some cooking tips. Sometimes it's giving people recipe book ideas or a couple of recipes. It depends on where the person's at, and knowing what diet is, it's looking at their health goals, their current health situation. I find the bioimpedance for the food often helpful.
Mm-hmm.
And then just their signs and symptoms of what's going on. You get a sense. Sometimes their blood type can be helpful. And the hormone picture, especially for women. You see women with PCOS or estrogen, overage, then it's modifying foods and stuff for that. They're very carb sensitive, insulin sensitive. And then, when times of stress, your body has different demands sometimes, when you're not. Sometimes it's an 80-20 rule, 80% of the time you eat really, really good, 20% of the time you go and have fun. Or it might be, like I eat super clean, except for when I go on vacation. And then, I'm going to
wheels fall off.
Have some, I'm going to have, they're going to have what I want for a week. And, and as long as it's not putting you back too far in your health, and you just know that, hey, that's a treat, and enjoy it. I always say that if you're going to do, like, go and enjoy it so that you fully experience that experience.
You got to live.
Then, and then get back to it. Like I've had people, like those little emails, like, kind of fell off the wagon. I really wanted to do the gluten-free. I know I was feeling a whole lot better on it. But oh man, like mama made pasta, and then it kind of, and then, kind of went downhill from there. And that's why I didn't call and I didn't book the appointment because I felt guilty. And I'm like, I don't feel guilty. I mean, like, just do a U-turn, right? Like, okay, like you found that it didn't work for you. You're feeling better before. Just do a U-turn. Just go back to where you were. Start over again. And get back on the, just get back on the roll. And oh, I can do that. It's just like, it doesn't have to be like an all or nothing. Just,
you can climb out of that cave. Yeah. I think sometimes it's easy to forget that, and stress levels just like can knock out your sort of logical thinking. You think you're stuck in this rut, but it really is just as simple as just change one habit at a time, right? So I love that. I wanted to talk a little bit more about that. You talked briefly about the ADAPT cert, and I have a personal interest in this because I've actually almost registered as a health coach with the Kresser Institute. Talk about how you landed on that cert and what it all was involved with that course. You said it was about a year. So what all was covered in that course, and how has that been useful in your practice specifically?
Yeah, really useful because it went through a lot of different laboratory analysis and multiple ones in case studies. So you're looking at, these are all the tests you could do to kind of look at the full picture of what's going on and getting a sense for how to identify the root cause of disease. So Chris is really good in his research. He is very good at teaching. And for me, the big takeaway on that was utilizing lab testing more to my patient's advantage, feeling more wise in knowing when to order something. Because, for us in Ontario, it costs money, right? Benefits do pay for some, but it quickly gets eaten up because some of these tests are quite expensive. And when you start talking about, $600 and up for some of these more complex tests, you want to make sure that the patient is getting value for their money, because I'm saying that this is what you should do, right? You want them to say, yeah, that was a really good spend of my money. You want to make sure that that they're feeling that. So it's being able to discern which test to do. And there's some tests out there like the SIBO breath test. I mean, SIBO is out there. And I just found that through learning that, I mean, Chris did a ton of stuff on gut health when I was doing the program because he had a lot of issues on gut health. And so learned lots of the different tests with regards to things going on in the gut. And, really so much starts in the gut. So it makes sense when you're doing holistic medicine. Anyways, with the SIBO breath testing, it's really just not that reliable, right? You can do it. It gives you fancy graphs, but it was poorly repeatable. You could do them. Okay, yeah. But what I found is if I were to do microbiome analysis and look, the stool analysis with parasitology and take samples over 3 days and then do the PCR testing and the microscopic testing, that gave me much better information. And you could kind of tell if that's going on, and with their symptoms, that's what SIBO is. And you kind of know why you get SIBO. And it's like, okay, I'm going to treat the lower gut, on the way through, the upper gut's getting, when I treat with what I treat, it gets treated as well. So you're basically cleaning it up. So why would I have somebody spend that money on testing? Right. So it's just the discerning
Right.
and understanding. So it was a year-long course. It went through, all of the different kind of physiological systems. So cardiovascular, like all of your, cholesterol, and looking at your heart health and different, why should you test for ApoE or ApoA or, little ApoA or little a, like it talking a lot about, more details that your average person's going to be like, I don't really care, just tell me what to do. But as a functional medicine practitioner, you're looking at, root cause, and then how do you catch things early so that you can hopefully avoid taking something like a statin or whatever to talk about cardiovascular health.
Right. Yeah.
With the health coach program, you want to be careful because Chris is really good in educating and does his research. So the health coach program is that piece to help people make those changes. It's really change management. People don't inherently like to change. They have difficulties knowing those steps to take to change. The health coaching program helps
dive into the psychology a little bit.
Dives into the psychology of it. But as a health coach, you are not allowed to diagnose.
Right.
You are not allowed to treat or prescribe. And you have to think, okay, that just gives you the coaching and the psychology part of the toolbox. So you just have to recognize, is that the tool that I want to have to work with my clients?
Right. Fair enough.
And a lot of coaches are looking to, let's team up with a naturopathic doctor so that I can do all the coaching and then the naturopathic doctor can do all the testing. That works in some of the more sophisticated clinics where you have multiple practitioners and health coaches and that. But I find single practitioners like myself, we do a lot of that coaching as a part of the whole program and moving through. Maybe not as well as as you might do going through that program for just the health coaching. However, little 15-minute appointments, every other week or every week get people pretty far, right? It's just like, okay, well, why isn't that working? Let's try this instead. So I have talked to a health coach down in San Diego, and we're kind of test piloting to see if my patients might pick up on what she has to offer. So I could certainly link you up with her, and you could chat with her and just see, the wins she had, because she loves what she does. She's trying to make it more of a full-time job, and right now she's working in another full-time job.
Is that Emily?
She has some great,
Emily. Yeah,
you connected with her. Okay.
She was our last episode. We're publishing that one today, actually.
Okay, so you've talked with her. So she's lovely, and I mean, she's got a master's of public health, so she's got some great credentials. She would be fabulous at health coaching, and it's just getting that traction with people.
Yeah,
awesome.
That's great.
You mentioned a little bit earlier, everything starts in the gut, and I'm not sure if Craig had mentioned it in the bio when he introduced you, but you are a #1 best-selling author for through Amazon, as your book came out. How long ago did your book come out, Beyond Digestion?
February of this year.
February this year. So I know Craig and I both had the pleasure of reading it, and I just definitely wanted to just touch on the gut a little bit more before the end of this episode. And I know we can definitely rabbit hole on several different topics. But what can you tell us, like, just based upon that statement once again, like everything starts in the gut. I wanted to like maybe touch on like acne or sleep or hormones, like cortisol was one of my issues, testosterone being low. How does, and then SIBO kind of, there's so many different things that happen in the gut. And then why is that the #1 thing to focus on, and how does that affect everything else?
Well, Kyle, you have to think that 99% of the genes that you carry around in you are not you. They're your microbiome. So if you have influence over that microbiome, you have influence over a lot of things in your health, right?
Yeah.
And 90% of our serotonin is made in our gut. Okay, there's over 22 different types of serotonin in our body. If your serotonin is low, then that can sometimes lead to low testosterone production. To just make a point on that, 400 times more melatonin is made in the gut than the brain. The melatonin in the gut is used a lot to heal the gut. It's not light sensitive like the melatonin that's released from the pineal gland in the brain. Your gut microbes have a rhythm to them. They will locate in different areas in your gut to turn things on and off based on timing and migration, just like birds flying south for the winter. They move around at different times. They change with what you eat. They change with jet lag. Like if you're a pilot, you fight with this. Not only the sleep, but your circadian rhythms make a huge difference in how the gut is functioning. So your 70% or more of your immune system is in the gut. Okay, the other 30% is running around the rest of your body. So that's our immune system. Think, infection, everything. Most of your environmental contact is through, between your mouth and your bum, right? Like that's really outside of you, not inside of you. And it's one cell layer thick in many places. It's pretty crazy to think that's where we absorb our nutrients. It's where we change and convert our food into, our bodies and our beings. Like that, how miraculous is that? You can what you ate at lunch today becomes, your muscles and bones and teeth and eyes and skin. And over the course of 10 years, you will change every single cell in your body. So if you really do a good job in the last 10 years, you're probably going to look healthier than you did, a decade ago.
Wow, that's a great way to put it. I think if you know that you're going to be a different human being in 10 years, that what matters right now is, it is so important to being that different person in 10 years. Then I think that holds so much power in it. And that's kind of, working with you, that's kind of what happened with me. Specifically, this kind of leads me into my next question that I've kind of had. When you work through your gut and you're working, you're understanding that your gut has so much influence on your overall health. Do things show up like symptoms or a bad gut, like an unhealthy gut? Does that show up in different ways? Like I believe it does, like in like acne or like when you have bad sleeps or skin or like just different ways. Like what are some of those ways that it shows up, and maybe not necessarily just like gut distress, right? Like, is that correct?
Yeah, like so gut dysbiosis, like imbalance in microbiomes, imbalance in families. They've shown research, this strain, you're seeing more of the strain in this disease or this condition. Dairy and sugar are often implicated in acne. You see that come out in the skin, so your food relating to your skin health. But we also see hormonal imbalance, which, estrogen and cortisol and, that whole insulin regulation, stress picture, a lot happens in the gut there. So it's, making those balances. The the liver is literally downstream from the gut, and you talk about huge upsurge in non-alcoholic fatty liver disease. Uh, that's just huge when it comes to metabolic mess, kind of going even further bad, that type of thing. And
So
often it starts with stuff that's going into your gut.
so then it's safe to say, like, just because you don't have symptoms doesn't mean that there's not things going on in your gut, right? Or like just because you don't feel, bad, or you're feeling, you just may not be aware. So testing and like working with somebody, it's typically pretty good call for most people to do.
Yeah, like example with wheat, there's not always a tummy ache. 6 times more often, it's hurting the brain. It's causing issues in the brain. It's damaging the brain. And you might not really know that until until you do the testing.
It's true. It really is true. It's like the second brain, right? It's so connected. And I experienced that once I started focusing a little more on my gut health and wheat and gluten, my brain just works on another level. It makes me wonder how I functioned through university with my brain the way it was. That's great. I want to wrap things up with your own personal habits a little bit, Laura. And I think like when we talk about health and especially when we're in this field or we're coaching people or medical practice, we're constantly surrounded by it and people think that we've got everything figured out. Our habits are locked in, but obviously we're human and stuff happens. So I wanted to ask about where your personal priorities are now in terms of like your mobility, your strength, your conditioning, your mental health, your nutrition. What is your main focus right now on sort of your personal growth in terms of your health and fitness? And what do your habits look like around that?
So I've always been a very active individual. So physical activity is something that's always part of my daily routine, and I try to vary that with the season. Right now, swimming and hiking and walking and lots of gardening and that type of thing. Some biking when I'm able, and then in the fall, more hiking on the trails, less swimming, more yoga outside. And then in the winter, things more inside. I've got my, a gym at home that I work out in, and snowshoeing is so much fun outside because it's so important to get outside in nature. It's really, really important. I love my garden. My son has his master's in ag, and he has like a kick-ass garden. You guys would be so jealous.
It's amazing.
Because he just keeps bringing me vegetables. So I mean, if you know what to do with Turkish eggplant, let me know. I'm bringing you some. Because I have no idea what I'm doing with these. So we've been preserving for winter, and our freezers are full. So now I'm like dehydrating vegetables and making my own beetroot powder.
Wow.
So it's just like, what else can we dry and preserve? I'm picking herbs all summer long, making teas and stuff for home, my cold and flu teas, my relax teas, and um, just things like that. So it's part of that hunter gatherer using just your actual motions and movements. And I know you guys are big in this, just those functional movements of bending and lifting, like a day out in the garden. I've got like lots of flower gardens and things like that, but then helping my son in the vegetable garden when I'm not doing the other stuff. I mean, yeah, you're just moving and bending and lifting. And by the end of the day, you feel tired, but you feel good because it's so detoxing.
It's true. Yeah. So it's all on the scale. Like gardening is just like a scaled deadlift. You're just picking up some stuff off the ground. And maybe you're not doing it with a few hundred pounds, but you're strengthening your endurance. So yeah, I love that.
And I might not have the size of garden that you do, Laura, but I know that anything that I pick out of my garden, I absolutely appreciate eating it so much more. And there's like zero chance that I'm wasting any of it, just for how much work goes into it, right?
Yeah, you work so hard for it. Yeah.
Yeah.
And it's so rewarding too, to know where it came from, and to think that, in the middle of January, you're pulling out some peas or some beans or some beets or, something, something that you put down.
That's awesome.
In the summer. Yeah.
Cool.
Yeah, nice.
Well, the book is Beyond Digestion by Dr. Laura Brown. And if you guys haven't yet, I'd highly recommend you check it out. We'll put a link to it in the show notes. It's a great read. It's definitely eye-opening. It gets a little sciencey for you, for those of you who like the science stuff, but it'll never really go over your head. There's lots of good kind of basic analogies that bring it back to home and make it like practical advice that you can use. So thank you for putting that book together. I was glad I got to read it. Thanks for being a guest here, Laura.
I really appreciate it. It's always a pleasure. Thank you.
Awesome. Well, thanks so much for joining us here on this episode, guys, and we'll see you next time on Healthspan Academy.